Hey everyone, welcome back to Meet the Experts. I'm your host, Mariella Pepin, and today our expert is...
I'm Anna Grancher. I am a physician assistant, and I'm also the clinical director at Spa Derma.
Thanks for being here, Anna.
Thanks for having me.
Anytime. Okay, so today we're talking about filler, and I feel like there's a lot of misconceptions and a lot of hoorah on social media lately about filler not being safe. So what do you have to say about that?
Yeah, I mean, unfortunately, I think filler's gotten a really bad rap in the last handful of years. It's a technology that we've had for many, many years, and kind of one of our most reliable things that we've had. Of course, there's always new things coming out and exciting, new technologies. But just because filler has been around doesn't mean it's unsafe. I think that actually lends to its safety profile.
Yeah.
So at the end of the day, filler is hyaluronic acid in a gel form. We use it for plumping lips and creating contours and shape in the face, replacing lost volume. And it's actually one of the most safe treatments that I feel I perform. What lends to that is our bodies are familiar with hyaluronic acid, right? It lives in our skin, it lives in our joints. So it's not this weird foreign material. And the beauty of it is that there is an enzyme or an antidote that is called hyaluronidase, Hylenex, that we can use to dissolve filler. So I tell my patients, listen, we never want to go into a treatment thinking, hey, let's just plan on dissolving this if we don't like it. It's not like trying on a pair of jeans, right? But if we do have a complication, an issue, they do happen, right? Or just an undesired result. Maybe, time has changed things. Age changes how things lay in our face. We can dissolve it. And that cannot be said for some of the newer things that are out there, right? So safety to me is, if I have a complication, can I handle it? And is this product, has it stood the test of time? There are thousands upon thousands of clinical trials, data, studies on these products, and they're safe, right? So I think it just starts with finding an injector who you feel comfortable with, who understands your needs, and then kind of picking the best product for you.
Awesome. Okay. So I feel like this bad rap kind of started or was fueled by these claims that filler stays in your body forever, and that even if you try to dissolve it, it migrates and it ends up being all over your face and causing pillow face. And there was some anatomy scan that people were referencing saying, oh, look, you can see all of the little sparks or spectacles of filler, even though she doesn't have filler anymore. So what is all that about?
Well, I think we have to understand what we're talking about in terms of longevity. So a lot of times when I talk to a patient about, hey, we're going to do some filler in your mid-face, in your cheeks, I'm going to say, you can expect this to last 18 to 24 months or more. Now, when I say 2 years, 24 months, it doesn't necessarily mean that at 24 months, every bit of hyaluronic acid is gone. Medical imaging is a great thing, but in aesthetics, we have to look at what we're seeing from the outside, right? And what we're seeing on the inside. So, you may have had filler in your under eye area 10 years ago, and you can look at photos and, on the surface, you're like, yeah, I really don't see that result anymore. I, can't appreciate any sort of fill or volume left behind. But if I take an ultrasound, or in the case that you're talking about, someone did an MRI, and they could see, hyaluronic acid blebs left behind, right? So on the surface, that's what we care about, right? And yes, if we look far beneath, we may see remnants of these products for years and years and years. But again, lending to hyaluronic acid and filler, having some hyaluronic acid left in your tissue, if it's not causing any issues, there's really no data that supports that that's an unsafe thing.
It's not harmful then.
It's not
harmful. Because I think that's
harmful.
the notion that people are running with is oh my gosh, this foreign thing is in my body and I didn't even know it was there, or didn't want it to be there anymore.
And if you don't want it to be there anymore, we can dissolve it, right? And we can look under ultrasound and we can do ultrasound guided dissolving, and we can get rid of things if it just, you don't want it there.
Yeah.
Or maybe you're planning or prepping for a surgery. My background, I started in plastic surgery, and at times we would dissolve people's filler prior to them having a surgical intervention, like a facelift or, fat repositioning, things like that. So that's the beauty of filler, is that we can get rid of it.
Yeah.
And we can locate it.
Awesome. Okay. So conversely, since we're on the topic of dissolving, I once went to an injector who preached online that every single time you add filler to your face, you should dissolve completely what you had previously. What do you think about that?
Yeah, I think it's not as cut and dry as that. I would never make a blanket statement, because I just don't think that applies to all areas of the face and probably to all people's anatomy.
Okay.
I do think in certain areas it makes more sense than others. But if you love the way that your cheeks look at 3 years, and we want to do, I don't know, maybe something near your nasolabial fold, I wouldn't be like, oh, we need to dissolve this whole area, right? I do think for other areas like the lip, right? If you have any sort of, blurring of like the lip margins, or maybe like some little bumpy or lumpies, or just, things that we don't love, layering more hyaluronic acid on top of something that isn't living well or looking perfect, I don't think is probably the best. And I think as an injector, it's our job to say, okay, I think we should start with a blank slate.
Yeah.
But I don't think if you had filler in an area, it looks great, it's, looks like a clean slate to us, that you necessarily have to dissolve before you place new filler.
Okay.
Remember, this dissolving medication is just that. It's another medication. It does break down hyaluronic acid, right? So we're breaking down maybe the filler product itself, but we're also taking away some of our innate natural hyaluronic acid. Now, don't let that scare you too much, though, because hyaluronic acid turns over in our bodies so rapidly.
Your body's it's constantly making more.
Yes. So if I deplete some of your hyaluronic acid when I take away some of your lip filler and we do some dissolving, your body is recreating that hyaluronic acid literally within 24 hours.
Nice.
I would suggest not doing tons and tons of unnecessary hyaluronic or dissolving treatments. I don't think that's probably great in the long term, but there's really no harm in doing some minor applications of that to give yourself the best result.
Okay. Awesome. So there are some other types of products that are injectables that can't necessarily be dissolved, and I think people are a little more cautious about those.
Yeah.
What is the difference? How can you resolve complications if you can without dissolving, etc.?
Yeah. So the beauty of these hyaluronic acid fillers is that we do have this antidote, right? That we can dissolve them. There are plenty of other things that we do in medical aesthetics that don't have that ease of reversibility. I think two that we work with really commonly fall into our biostimulator umbrella, and that's Sculptra and hyperdilute radius, or calcium hydroxyapatite. These are not something that has a simple antidote where we just say, oh, if we have a little lump or bump from this, we just stick in, this enzyme and it breaks it down.
Okay.
Which it can probably sound a little scary, right? You're like, oh, then what do I do?
I was like,
right?
Is this permanent?
They are not permanent, right? And there are ways that we can handle complications. So I think it's really important that when you're seeking out these injectable services, that you kind of credential your provider, right? Have you taken complications courses? What kind of training have you done on these? I think that's becoming a really important and necessary part of this industry, is not so much just all the training on how to administer these things, but also how to handle complications, right? Like,
absolutely.
This is a medical procedure. And I will tell you, complications are extremely rare, but they do happen.
Yeah.
Of course, expected things like a little swelling or a little bruising, like from my recent filler that I just had done. Those things are expected. But lumps and bumps, hypersensitivity reactions, there are vascular complications that can happen. They can be managed. And there are plenty of well-publicized literature on how to handle these complications. And we have all those tools in our arsenal here at Spa Derma. So rest assured, if you do end up with a medical complication, we have the tools to handle it. But it may not seem as cut and dry when you're dealing with a product that doesn't have that simple antidote.
Yeah. Okay. So what are some things that can cause like those lumps and bumps, or for you to not get a result that you necessarily were hoping for?
Lumps and bumps, I think, can happen with any of these, with filler, with biostimulators. I think in the biostimulator route, a lot of times it's like an accumulation of the product.
Okay.
So we're injecting these kind of bathing the tissue, and it kind of looks like water. And then we ask the patient to massage the area, really to kind of infiltrate the entire area. So I think it comes down to injection technique. Is your injector kind of injecting this in the proper way?
Yeah.
And then are you following the post-care instructions properly? And those things can be done 100% perfect, and you could still have a lump or a bump.
Right.
Those things can happen. But again, we do know how to remedy those. Again, they're very rare. But things that predispose you to that are, autoimmune conditions. So if you take a number of medications, your immune system is heightened from something else. We ask you not to have like dental work right before or right after these treatments, or don't get immunizations.
Yeah.
I know you can't help if you get sick right after, but if you're on antibiotics or sick at that time, we just want your immune system to be steady, like
as
relaxed and
possible.
calm. But yeah, they do happen, and if we encounter them, then we know how to take care of it.
Okay, so there's a fix. No need to worry.
There's a fix. Don't lose any sleep. Yeah.
Well, thank you so much for joining us today, Anna.
Thank you for having me.
Of course, anytime. Before you go, though, we do ask all of our guests to leave our audience with a little piece of advice or a tidbit or a life motto. Anything you want to share?
One thing I find myself saying quite frequently, as I train a lot in this industry, and attempt to provide mentorship, and I say that good things happen to good people.
Aww.
And I think if you just lead with goodness and kindness and a sense of integrity and helping others, that will come back to you. And I think in medical aesthetics, like, it can be a little bit cutthroat and a tough industry to be in.
Yeah.
And so I just try to impart to everyone that I come around is just, be good, and good things will happen.
Oh, I love that. That's so good. Okay, well, thank you so much.
Thanks.
We will see you next time on Meet the Experts. In the meantime, let us know what topics you want us to cover next, and don't forget to follow us to keep up with all of our episodes.